Hello everybody, I'm back. Dr. K.K. Agarwal, President Heart Care Foundation of India and Confederation of Medical Association of Asia and Oceania. And you are watching Med Talks with Dr. K.K. Agarwal, 43rd episode and COVID special edition. Basic purpose to take the fear out of the mind of the people. Let's have the headlines of the day. Padma Vibhushan awardee and Bharat Ratna awardee, former President of India, passes away. Within 24 hours of Dr. S. Padmavati, at the age of 103, India's first female cardiologist, and both died of COVID-19. Unpredictable virus, not stopping its menace all over the world. Two important personalities died in a matter of almost 24 hours. India never wants to become number one, but the way things are going, India may become number one in terms of the COVID statistics. Today, we have the maximum number of new cases crossing 80,000, but we may end up into number 2 position, crossing Brazil within 10 days, and then we may be able to cross America if the current trend continues. Telemedicine facility to open in a fortnight in Delhi's Lok Nayak Hospital, and nearly 500,000 people have registered for a free universal coronavirus testing program likely to begin on Tuesday in Hong Kong. Hong Kong, with the help of the China, is trying to do a universal corona testing program. Remember, China, when they had 6 cases, they checked up 6.7 million cases in 2 weeks' time. The same exercise they're trying to do in Hong Kong, not possible in India. Let's go to the subject of the day. We will be talking about the current issues in COVID-19. We will take up some of the issues, and I have an expert with me. Let me introduce my expert today. All of you have seen him in the sports industry. We were all his admirers when he was a cricket commentator, but he was also a ENT specialist par excellence. He has worked for 45 years in the medical profession, academics, government service, corporate healthcare management, promoting quality in health and healthcare policies in Irvin, Maulana Azad, Mulchand Hospital, Max Healthcare, and now serves as a medical advisor to Fortis Healthcare. When it comes to policies, whether it is NABH, Quality Council of India, or FICCI, nobody can work without him. He is a person par excellence as far as health policies are concerned. So welcome, Dr. Puri. But before I go to the health policies, first I would like to pay homage to our former President of India and also Dr. S. Padmavati. This virus is not leaving anybody. It is beyond, it is a mysterious virus, and to whom it is going to, we have former president, we have a senior cardiologist, we have a senior chest specialist from All India Institute of Medical Sciences, we have a minister from UP. They all have succumbed to the coronavirus. So I want to ask you, my first question is that when it comes to locking, it is the responsibility of the government to look after. But now when it is unlocking, it is individual responsibility to prevent himself or herself. Dr. Puri.
First of all, thank you very much, Dr. Agarwal, for having me on your show. And through this show, I'd like to pay my homage to both the renowned people that you mentioned, and not just them. I would also like to pay my homage, my sincere gratitude being expressed through this medium to all those healthcare workers who got infected with the COVID virus, and many of them have lost their lives. So, Naman and Pranam to the service that you've all provided. I happen to have had an opportunity of having worked with Dr. Padmavati in the sense that she was the director principal of Moranabad Medical College and associated hospitals when I was lecturer there. And incidentally, you mentioned my association with cricket, and therefore I happen to have Chetan Chauhan, the former minister in UP, as a good friend and somebody that I've known right throughout his cricketing career. So I feel that loss of both these individuals personally, as also, of course, as a fellow Indian. You're absolutely right that whilst the policies may be made by the government of the day in various parts of the world, ultimately we have to realize what our own responsibilities, both as individuals and also as a community, are. And sadly, this is what has been found missing, not just in India, but in many parts of the world. And this is perhaps one of the factors which is resulting in the persistence of this epidemic, the resurgence of this epidemic in certain parts, and in many parts, the return to, shall we say, a little bit of hooliganism because of the people feeling that it is their right to do what they want. Sadly, people know their rights, but not their responsibilities.
Thank you. That's an important issue. People know their rights, but equally important is their responsibilities. Coming back to the second issue, and that's an international cricket. The whole world is watching that if this IPL becomes successful, though we had a very first wicket down with the coronavirus, some of them getting it. If this IPL becomes successful, the whole world is watching, and that will open up sports, that will open up arts, everything may open up. So the whole world is watching about the success of IPL. And this IPL has shown us in Dubai. Another important thing is 3 negative tests. Normally, the government policy is if 2 consecutive tests are negative for RT-PCR, you are negative. They have gone to the extent of doing a 3 negative tests. Do you feel that that's important, and that may also be a new policy that you do a 3 negative test to be doubly sure?
Yes, this is a very valid point that you are saying, that IPL success matters a lot to cricket as a sport, and just to India, but also what the success of this will mean to the entire sporting world is being looked at with great interest. But it is pertinent to point out that IPL currently is doing exactly what is being done when the series of test matches and now T20 matches between England and Pakistan is taking place in England. They are doing repeated testings. I'm not quite sure whether they are doing 3 tests, but definitely they are doing multiple number of tests there. And in United States, of course, where the sports of basketball and baseball are continuing with sporadic kind of stoppages.
We need to repeat, Dr. Puri. There was something wrong in the connection. So can you repeat about the IPL?
Yeah. So what I'm saying is, it is absolutely true that the IPL is of vital importance to all sports. Everybody is looking towards its success or failure, depending upon how it goes. But there is a precedent, and that precedent is that currently in England, cricket is going on, not only just county cricket, but also Test cricket and T20 cricket. England played West Indies in empty stadiums, but there was repeated testings and multiple times. So, and people and all the players were quarantined more or less in their room. So they created bubbles within the hotels, and you could not go out. One English player did go out without informing, and he was promptly dropped the next match and heavily fined. In US, basketball and baseball is continuing. So it's not that India is, of course, for the first time going to be playing cricket after a huge hiatus. But cricket is being played and other sports are being played. For example, in Germany and all over in Europe, football has gone on. And in fact, the European Championship has just finished. So it's not that the sports has come to a dead halt. The thing is that in sports, there is nobody to watch. So you're watching sports on television or you're following it on radio, but you're not able to go into the stadiums to watch them live. And the players themselves have to be cocooned and put into a bubble. So sports is going on, but for Indian cricket, it's a novel experience. You are absolutely right again that two players from Chennai Super King, Rituraj Gaikwad and Deepak Chahar, turned out to be positive, along with a large number of support staffs, despite the fact that before they boarded, they had got an RT-PCR done. But thanks to the repeat testing, this has turned out to be positive. And I think you are absolutely correct in your assumption that maybe this is going to be the new normal if you are going to be in situations where you are going to be thrown together and social distancing may not be possible, at least amongst the players.
So I only want to add is that when you're comparing US, Europe, and in England, when the cricket is going on, they all are from the same country. Here, in the same group, in the same match, in the same one team, you may have players from different countries. That's the difference. Therefore, IPL, I am watching it with a close interest, because in a single team, you may have people from 3 or 4 countries. That may not be true in US or in the football of Europe.
You're right, because in the IPL you have players from all over the country coming over. They have been in camps in different cities within India. For example, Chennai Super Kings had their own camp in Chennai, and I know that Delhi has been having a camp in Andhra Pradesh. But the point that you raise is extremely important, that you're going to have players from all over the world mixing together within the same team. And that perhaps raises the ante a little bit and perhaps raises the specter of an infection being transmitted. So maybe I would tend to agree with you if you were to propagate that instead of 2, you do 3 tests. I think doing more is probably a better precaution than doing less.
I want to add one more. When I was talking to one of the US policymakers, and they said they intend, whenever they open their schools, every class will have a pool testing in the morning. The report will be available within half an hour. And they say 64 children can be, pool testing can be done. And if anyone is positive, that means somebody is positive. So therefore, you can do before every match in the morning, you can do a pool testing of all the players, the player A and player B. If anybody is positive, the match should be abandoned, or all 11 players should be tested to find out who is positive. So therefore, that will be an extra effort which can happen. Because if you want a IPL to be a success, even if a team has to be asked to go, it's fine, but the sports must continue. This is what I want to say. So the concept of pool testing of a team early in the morning to find out that all of them are negative. Dr. Puri.
Yeah, perhaps that is going to happen in the near future. But the good thing, I think, as you would know more than me, would be the fact that now you have a far more reliable antigen test, which Abbott has brought out, which is available in the United States now, which gives you a result in 15 minutes and has a high specificity and a high sensitivity. So maybe there'll be many more of such type of tests coming, which will change the picture of having a greater amount of participation in public events in the future.
Coming back to your association with 3 important organizations, FICCI, NABH, and QCI, what are the role they are playing or they have played in COVID management?
See, from the perspective of NABH, as you know, this basically deals with the quality aspects, not with the quantity or any such thing. But it has been at the forefront of trying to ensure that, for example, the our hospitals just did not have the concept of the type of infection control that is required in the current pandemic, and everyone has learned on the job. Only Kerala had some experience of Nipah virus and therefore a little bit of exposure to the SARS type of virus situation. But I think by holding webinars, by being in direct communication, I must say that the current NABH is very different from the one that emerged 15 years earlier, and I've been associated with it since its inception. That this is a far more proactive organization, and the number of hospitals which are joining require a lot of hand-holding, particularly those which enter through what is called the HOPE portal. So it's an online kind of a registration. You can't go and do a survey yourself. So that's an important role that NABH is performing. Its role is as the quality watchdog and the accreditation watchdog. As far as FICCI is concerned, it's the voice of the industry. It's the oldest industry body in the country, which was started at the behest of Mahatma Gandhi. And through its health services committee, through its public health committee, and through its medical value travel committee, it continues to contribute. So what it has done is that it's a part and parcel of the entire exercise about COVID preparedness that has been done in consonance with Niti Aayog, with Government of India at every step of the way. Our purpose really is to prove to one and all that as far as COVID or pandemics of this nature are concerned, it is not one person who can handle it. There is no division between public and private. The two must work hand in hand and put their shoulders together if we are to alleviate the sufferings. And this is what, as an organization, FICCI has tried to do, to bring all the private players together with the government, whether it was from the point of view of getting the labs together so that now you have a large number of labs doing the testing, which were all private labs, whether it was from the perspective of hospitals providing COVID treatment. Thousands of patients have been treated, or even public-private partnerships, whereas you will know that 3 major hospitals, all based out of Haryana, have taken up a 4th hospital, which was not equipped with either manpower or equipment, and they've converted that into a COVID hospital. So whether it is private, whether it is public, or it is public and private, that all together, we have to fight this pandemic, and FICCI has been at the forefront of doing it. From the perspective of individual organizations, all the organizations that I am aware of, private hospitals, be they small hospitals or large ones, whatever their capacity has allowed them, I don't think anybody has been turned away. So a person who has come with a stroke or a person who has come with a gallbladder pain has got the treatment. My point is, it's the fear that has not allowed people to approach, but the hospitals have opened their doors and the government has come out with these guidelines. That's perhaps the reason why such a large number of people from the healthcare sector have got infected, and why there is a highest number of deaths of doctors and nurses and paramedics in the COVID pandemic. The ratio is quite alarming, and the government figures point them out. And let me last but not the least, and you've been the president of that organization, and that is the Indian Medical Association. You've also been the president of the Delhi Medical Association. You know this, that a very vital role is played by the general practitioner, the family practitioner. And it's no joke that 188 family practitioners have lost their lives because they put themselves as the front line. So my salutations to them and to all of you and people like you who have led these organizations.
So I need to discuss 3 more important points with Dr. Puri. One is the role of a corporate sector, where he is a medical and third is his role as an ENT surgeon, but after a short break. You're watching Med Talks with Dr. K.K. Agarwal, and we are talking about common current issues with Dr. Narottam Puri. डॉक्टर पुरी, अभी आपने एक जिक्र किया कि भारत में जनरल प्रैक्टिशनर्स, कल एक टाइम्स ऑफ इंडिया की स्टडी भी थी कि 87,000 हेल्थ केयर वर्कर्स को कोरोना हुआ एंड 500 एंड समथिंग इवन डाइड. क्या when I spoke to as a president of CIMAO to Korea, Singapore and Hong Kong, they said in the first 15 days, जैसे ही ये बीमारी आई, उन लोगों ने हर अस्पताल को हिदायत दे दी कि emergency room should be converted into airborne isolation infection room. That means no patient can enter an emergency. He has to go through a AII room till his test is positive or negative, so that no hospital doctor gets an infection. One. Two, that in the AII room in the ER, RT-PCR machine should be available, so that testing is done rapidly. Do you feel that even now there is a time, at least for the private sector, to sit together, maybe FICCI, maybe anybody, to come back and say that every healthcare center, emergency department becomes a negative pressure room? If they can't, at least put a air purifier with a ultraviolet plasma therapy, plasma unit, so that they can kill the virus. Otherwise, this number of 500 and something will become 1,000 in the next few months.
Yes, what you're suggesting is eminently doable. And the only point is that the unfortunate people who are dying are those who have contacted this infection for three reasons. One, let's take the general practitioner or the family physician. Where will he put? He's just got a small room in which he's practicing in probably one gali or mohalla of one of the tier 2 or 3 cities. So where is he going to put these equipments, and who's going to fund it? That's one. The second is that initially the large number of people who died were because we didn't have proper knowledge or exposure to the adequate amount of coverage that was needed, the way a PPE was to be doffed and donned, and we didn't have adequate knowledge about how and to disinfect. The third part was that even RT-PCR and your magnificent communications that I get every morning, which keeps on informing, you mentioned very clearly in that the numbers that are being mentioned are, when RT-PCR is taken as positive, only as 67%. So there is in that molecular test itself an inbuilt error that 33% you are not going to be able to pick up in many instances. Of course, it depends on when you are testing. Secondly, whilst it is a good idea what you're saying, I think in a nation of 1.3 billion people with such diverse demands on the sector, it's very difficult to fulfill it. In an ideal world, of course, one should, but now not having invested in healthcare preparedness has come to bite us. So it's not that the private sector doctors only are dying. It is the family physician, it's the government doctor. I don't think a doctor or a nurse or healthcare worker, they should be private or public, not when you are dealing with a pandemic.
So I would only say is that in a private clinic, at a GP clinic, at least a simple air purifier, which FICCI can negotiate so that it is subsidized, and a simple air purifier with 6 exchanges per minute, per hour, make all the difference. It can, and because simple, I'm not talking about a AII room. And if you read the up-to-date literature, it clearly says that if you cannot provide a AII room, that an air purifier with 6 to 10 exchanges per hour is a must. Simple thing. I mean, I'm not even talking about a plasma unit to UV light, because that's costly. An air purifier should not be, organizations like FICCI or a corporate sector start negotiating for every doctor in the country or IMA. It will be available between 10,000 to 20,000. That's not a very high cost. People can't invest. People can invest for that. Now, coming back to the role of corporate sector, I'm again coming back to the CSR activity. Why all the CSR projects in the country have not combined together to make a COVID CSR, because I have not heard of a that all the public sectors in the country CSR project for the next 2 years will be COVID, COVID, COVID. It's not happening. Do you think any reason for that? That why all the CSR groups have not combined together and done a common CSR project, which can be a research, which can be a vaccine, which can be a diagnostic, which can be anything.
I think that's a very good idea that you are propagating. At FICCI, the president of FICCI this year happens to be Dr. Sangeeta Reddy, and as you know that her interest is healthcare. So she did convene a meeting for the use of CSR funds, and certain steps have been taken. I must say that kind of cohesed the entire disparate elements into doing something collectively, and some movement had taken place around that. The sad part is that the industry is bleeding. Every part of the industry is bleeding very badly. Health sector more than others, but the fact is that there is just no money. And the second part is that fundamentally in industry, there is always competition. And it is not very easy for a cohesive whole to emerge for doing a good thing. But there are plenty of examples. This is too short a time for me to delve into particular individual cases. But like the example that I gave you, Medanta, Artemis, and Fortis came together to run a hospital purely for COVID. And they are running it out of a building that belonged to another hospital, but they didn't have either the equipment or the manpower. You can say that they're using CSR in a different way. But my point is, earlier, CSR was not allowed to be utilized. So if you and I were running a healthcare company, we could not utilize our CSR funds for healthcare. We could use it for some other purpose. Now, of course, a distinct difference, that distinction has been done.
What I wanted to say was that all the non-health CSRs, I'm talking about every CSR, whether it is Reliance or everybody, if they focus on CSR on a healthcare, if they work with the private healthcare industry, things may change. That's what I'm trying to say.
No.
They are 2%. They are 2%. If available to all of you in the healthcare, you can create lots of COVID hospitals.
Well, मैं तो ये कहूँगा आपके मुंह में घी शक्कर अगर ऐसा हो जाए.
So that's what I wanted to say.
अपने आप का आइडिया बहुत अच्छा है और काश ऐसा हो पाता, पर कुछ हद तक हो रहा.
एक चीज और मैं लेता हूँ बिफोर आई टॉक लिटिल बिट अबाउट ENT, और वो है कि आज हाउ डज इट मैटर कि इंडिया में केसेस 1 लाख रोज के हो रहे हैं, 2 लाख रोज के हो रहे हैं. यू कैन चेक नाउ. इंडिया में कहते हैं 80,000 केसेस हो गए, तो ऐसा लगता है पता नहीं कितने केसेस हो गए, लेकिन आप 30 से डिवाइड करो तो आप बोल रहे हो सिर्फ 2500 केसेस पर स्टेट, लगता है कुछ भी नहीं है. So if you say 2,500 cases per day per state, it looks like so what? But when you say 80,000 इंडिया में लिखता है कि big number with that. So इंडिया में अगर 1 लाख केसेस भी हो जाते हैं per day, it doesn't matter. I think that focus of everybody, including the government, should not be on the numbers, should only be on mortality reduction. इस वक्त में जो लड़ाई चल रही है ना, इतने केसेस कम करने हैं, ये करने हैं, वो करने हैं, आप रोक नहीं सकते बीमारी को. You cannot stop. In India, you cannot stop. This number of 1 lakh may become 5 lakhs a day. Our effort has to be on mortality reduction, number one. And number two, the Prime Minister should come openly and say, मैंने जो करना था कर दिया. 5 महीने में मैंने लॉकडाउन में आपको सिखा दिया. मैं आपके घर में बैठ के मास्क नहीं पहना सकता. Now it is your item to protect yourself. आज की डेट में अनलॉकिंग में गवर्नमेंट can't do anything. People are on the road, they have to prevent themselves. Job of the government should shift from monitoring them to mortality reduction. I'm talking about a paradigm shift. And the paradigm shift is that अगर जैसे आज की डेट में हम पकड़ेंगे आपको, आपने मास्क नहीं पहन रखा, हम फाइन लगा देंगे, that's fine. But the more important should be on mortality reduction. Let individuals save their own lives whether they want to get it or not. That's my thinking.
Look, I think substantially this is what it has reduced itself to. The fact is that Indian mortality at the present moment, thankfully, is much less than what we are seeing in the United States or in Brazil or in certain other parts of the world, and we should be grateful for that. And the government and the public and the private sector, everyone has put up their hands in trying to do whatever they could. Now, as I said in the beginning, and you're absolutely correct, and you're echoing my thoughts, that if I am being stupid, then uh, then you can't hold the government responsible for it. And secondly, this obsession with number of cases out of a fear that the opposition will say this, etc., etc., has to go away. That is true, because the numbers are a reflection of the density of the population, its density, and the amount of testing that you do. So therefore, it is right that you need to focus, and I think they have done, focusing on mortality reduction. The second thing is that the government can only provide you a certain direction. They can provide you with equipment. They can provide you with knowledge. They can provide you with hospitals. They can do that. But again, it comes back to what I started off by saying, that I know my I know my rights, but I don't know my
Your responsibility.
responsibility. Mask is not important just for me. It's important for my friend. It is important for my family. It is important for my community. It is important for my city. It's important for my country. It is important for humanity. If I don't
So,
get this message, then I may be having eyes, but I have no vision.
absolutely. I may have eyes but no vision. Self negligence is something which government can't do. If you are neglecting yourself, you are going to end up into a problem, specifically in the COVID era. Lastly, I want to come back with to say, because the time is less, I would request Dr. Uh, Narottam Puri to share his experience as an ENT doctor, because this disease involves ear, nose, and throat. All three of them. It can nose is the gateway for this infection, and then throat is another gateway, because these are the two gateways, and because both of them are connected to the ear through the eustachian tube, and eustachian tube dysfunction is very common in this condition. Can you share some of your personal experiences of patients, or unusual manifestations or usual manifestations as far as ENT is concerned?
Well, from first of all, that I graduated 52 years ago, and my ENT experience after my post graduation is now 47 years. But being a cardiac patient, I have not gone to the hospital to practice my specialty because of the aerosol generating capacity of ENT has been high, and we need to have a higher degree of protection. Being 73 years of age and a cardiac patient, my juniors have not allowed me to go. My hospital has supported me. My organization has supported me. So I've been doing teleconsults. But what I can say is that gradually what I'm finding is that people who were worried every common cold as being COVID, that is no longer the case. So if I were to look at the last 1 month and compare it to May and June, I think there is a distinct change. Not every upper respiratory infection is being looked at as a COVID case, and people have started coming to hospitals. So my number of teleconsults, which I was doing in May, June, has come down because my colleagues are available in the hospitals, and I'm also beginning to direct them to them. And we do talk on WhatsApp if the patient is old, and my own patient for 40 years, he's not likely to be satisfied unless he sees me or talks to me. I don't think we have too many experiences to share which are unusual, in the sense that something presented unusually, but we had one case of epistaxis, which required a packing, came in the emergency, and at that time you just can't do any kind of a test, and that patient later on turned out to be COVID positive. Fortunately, we had a dictum amongst us that if you are not sure, you treat as if every patient that you're seeing is COVID positive. So whenever we are doing a tracheostomy, which is a aerosol generating procedure, my team is doing that, or they're packing the nose. of a patient who's suspected to be doing that or doing a fiber optic laryngoscopy, then we take it that it's going to be positive unless proved otherwise, and therefore protect ourselves like we would do as if we were in the operation theater.
I want to end by adding one thing is that hoarseness of voice as a COVID infestation is conspicuous by its absence. There is no hoarseness of voice seen. It involves the trachea, bronchi, it involves pharynx, but it spares the larynx. It doesn't cause laryngitis. It spares the joints. There is no joint pain seen in this particular condition, though we have a costochondritis, which is extremely common. It doesn't involve the mediastinal lymph nodes, though it causes mesenteric lymph node involvement. So there are certain things which are characteristically and conspicuously absent in this particular condition. Therefore, I always say this virus is mysterious. It behaves like a virus, but it needs antibiotics. It behaves like a virus, but it causes rise in acute phase reactants. Sometimes it behaves like an HIV, so it causes CD4 count low, but like an HIV, it is not a persistent case because antigen is disappearing. Sometimes it behaves like immunoinflammation, but the platelet count is not high. It reduces in this particular condition. Sometimes it behaves like a typical DIC with a D dimer high, but fibrinogen is also high. So everywhere it is, you think of something, then you say, oh my God, it has something like this. Something says, no, it's not like that. So it's a mysterious virus. And this mysterious virus, something is very clear is now it is acute, manageable, because we know how to reduce the mortality. It's acute, so therefore 3 months, manageable, thrombo, immunoinflammatory disease, viral disease. It's an acute, manageable, thrombo, immunoinflammatory viral disease. And important thing is that after 9 days, it is non-contagious. In the first 9 days, you need to be isolated. You're not supposed to come out in a clinic or show it to a doctor. You need to isolate. After 9 days, it is non-contagious. Therefore, all doctors in the country should open up, and open up, because they will only see patients after 9th day. So therefore, all those cases after 9 days you can see, and you can start if the Abbott-like antigen test is available. I think it will be easier even in your clinic to call a patient and do a rapid testing and see. I'm going to end by saying, Dr. Puri, कि मैं इस चीज को बार बार बोलता हूँ, वो है अतिथि देवो भवा, एंड दैट इज कि अगर पेशेंट मेरे क्लिनिक पे आता है, मैं उसके पैर धुलवाता हूँ, वो धोएगा नहीं तो शू कवर दे दिया, फिर मैं बोलूंगा हाथ धो, वो धोएगा नहीं तो बोलूंगा ये ले सैनिटाइजर, हाथ धो ले 20 सेकंड के लिए, फिर मैं बोलूंगा कि ये सामने सिंक पड़ा हुआ है, पोविडॉन आयोडीन का वॉश कर ले, वो पूरा मुंह साफ कर लेगा तो 20 मिनट के लिए उसका मुंह के अंदर में वायरल लोड कम हो जाएगा। फिर मैं उसको छोटा सा मीठा खाने को दूंगा, एक टॉफी खा और बता तेरे को लॉस ऑफ टेस्ट तो नहीं है, फिर उसको एक फ्लावर दूंगा, सूंघ के बता लॉस ऑफ स्मेल तो नहीं है। उसके बाद में मैं बोलूंगा SpO2 लेवल चेक कर ले और थर्मामीटर चेक कर ले, और उसके बाद में अपने से दूर साइड टू फेस टू फेस ना बिठा के उसे मैं 5 मिनट के अंदर में एग्जामिनेशन करके भेज दूंगा और बोलूंगा बाकी का डिस्कशन टेलीमेडिसिन में करेंगे। अगर हम इस तरीके से करें हर पेशेंट का, तो आई थिंक वी शुड बी एबल टू रिड्यूस द menace of COVID in our clinic. Your last comments.
Well, sensible what you are talking about. Unfortunately, in our specialty, हमें रूबरू होके बात करनी पड़ती है। अगर मुझे लैरिंक्स देखना है तो मैं बिल्कुल आपके सामने और बहुत ही 8 इंच या 10 इंच के डिस्टेंस पे होता हूँ। तो हर बात हर स्पेशलिटी में शायद ये संभव नहीं हो, बट जो आप कह रहे हैं वो वाजिब है, वो डूएबल है। दूसरी चीज़ ये है कि इसके अंदर जो कि कॉमन सेंस की बातें हैं कि भाई ये एक सिंड्रोम है, ये एक डिजीज़ नहीं है, ये एक वन सिंगल चीज़ नहीं है, जैसे मल्टीप्लिसिटी ऑफ इसकी प्रेजेंटेशंस हो सकती हैं। जो वरिंग ट्रेंड्स 5-6 महीने पहले नज़र आ रहे थे वो धीरे धीरे कम हो रहे हैं, तो फियर भी कम हो रहा है। लेकिन डर हटने का मतलब ये नहीं है कि आप बेवकूफ़ियों पे उतर आओ और आप सोशल डिस्टेंसिंग को भूल जाओ, हैंड वॉश को भूल जाओ और मास्क पहनने भूल जाओ। अब शर्म ये आती है कि पढ़े लिखे लोग जब आप बाहर बाज़ार जा रहे हैं, मैं फिज़ियोथेरेपी के लिए गया कुछ दिन पहले पास में ही एक क्लिनिक में, और मेरे को एक्यूट पेन हो रहा था। तो एक 2 शख्स ऐसे जो कि गाड़ियों से निकले, बड़ी-बड़ी गाड़ियों से, और एक का मास्क यहाँ गले में लटक रहा और एक का कान से लटक रहा। तो अफ़सोस होता है कि ये देख के कि पढ़े लिखे लोग मास्क लेकर निकले हैं, लेकिन उसको ठीक से पहन नहीं रहे। तो ऐसे मास्क का कोई फ़ायदा नहीं है। और अगर आप
correct and consistent use of mask.
तो ये
So I'm going to end by saying is that at least at the ENT surgeons, those people, if they ask the patient to gargle with povidone iodine, it may reduce their viral load for 20 minutes, including that. This is what dental people are doing. So I'm only replicating what dental people are doing, and give him a small piece of cotton filled in povidone iodine and close their nose, unless you are examining the nose, and that may give you a 5 minutes of a area which may have a reduced viral load. In any way, you are wearing a mask, so that may give an extra advantage of reducing it.
You're very right, but just one request: don't forget that there are people who are allergic to iodine.
Yes, absolutely. But povidone iodine 0.5 to 1% cannot cause allergy. It's not a concentrated. It's not a concentrated povidone iodine used to hand wash.
So use the povidone iodine gargle.
Yes, it is a. I'm talking about 0.5% iodine gargle. This is what I'm talking about.
Available as gargles.
Yes, but it is gargle. Absolutely. I'm talking about 0.5% gargle, which is 0.5%. And other concentrated forms are 10%. I'm only talking about 0.5 to 1%, which you can also use it as a soaked cotton in your nose. That's what all the dental people are doing today. And let me thank, because the time is up, let me thank Dr. Narottam Puri. I'm a great admirer of him, and to be here with us and share his views, and a person who at this age is still contributing maximum for the welfare of the community. Let me thank him. Namaskar, sir. And that's all for today. We'll be back tomorrow, 7 p.m. with another show. Stay tuned.